Today we're going to talk about telephone techniques, Chapter 10. The telephone is one of the most important pieces of equipment used in a healthcare facility. It's used to communicate with patients, other healthcare organizations, and suppliers. It would be difficult to run an office without a telephone. It's often the first point of contact with patients, and this is an opportunity to make an outstanding first impression. Developing good telephone techniques will make you a valuable asset to your employer. Learning objectives for Lesson 10, identify and explain the features of a multiple line telephone system and also explain how each can be used effectively in a healthcare facility. Also discuss the use of cell phones. Do the following related to effective use of the telephone. Discuss the telephone equipment needed by a healthcare facility. Summarize active listening skills. Demonstrate effective and professional telephone techniques. Consider the importance of tone of voice and enunciation. The continued objectives explain the importance of thinking ahead when managing telephone calls, also describe the correct way to answer the telephone in the office, discuss the screening of incoming calls, and list several questions to ask when handling an emergency call. Place callers on hold and correctly transfer a phone call. Continued objectives, do the following related to taking a message, document the telephone messages accurately, list the 7 elements of a correctly handled telephone message, report relevant information concisely and accurately. Discuss various types of common incoming calls and how to deal with each. Discuss various types of special incoming calls and how to deal with each. And then discuss how the medical assistant should handle various types of difficult calls. Discuss typical outgoing calls, including why knowledge of time zones and long distance calling is necessary. In the last 2 objectives, discuss the use of telephone directory and describe how answering services and automatic call routing systems are used in a healthcare facility. Discuss the legal and ethical issues related to telephone techniques. Familiarity with a multiple line telephone system is a must for the medical assistant. Even the smallest of healthcare facilities has at least 2 telephone lines, so that patients rarely get a busy signal when they try to contact the office. This allows you to transfer calls and possibly set up conference calls, and then has a button for each line, which flashes when a call comes in on that line. The button flashes a different rhythm when a caller is on hold on that line. You should familiarize yourself with the multiple line telephone system used in your healthcare facility and refer to Figure 10.1 in the textbook. Most business telephones have a handset that can be used to answer the phone. However, the medical assistant who most frequently is responsible for answering the telephone may want to consider using a headset instead. It can improve your ergonomics and improve neck strain. It can be a combination earphone and microphone and can adjust the volume in the earpiece. Many headsets can be muted so that you can speak with someone without the caller hearing you. For instance, you're speaking with a patient on the phone and you want to ask the provider a question about the patient. You can put the headset on mute so you can actually still hear the person, but they can't hear you. There's also Bluetooth, a type of short-range wireless technology that you all know about. It allows you to be more mobile while on the telephone. I know we had one advice nurse, she kept walking around the office as she was answering. The problem you need to consider is HIPAA. You will need to make sure that people are not overhearing the call and what's going on in the call. Patients. Because this type of headset is not visible, though, people may not be aware that you're on the telephone and may start a conversation with you. You should politely indicate that you're on the telephone and you will respond to the person when you can. This would frequently happen. It would look like we weren't working, but we would actually, when I was working as an advice nurse, we'd actually be on the phone talking to someone or listening to someone at that point. And then someone would come up and not realize that you're on the phone. Several features that the phones have that are available. Their speakerphone function allows you to hear and speak to the caller without using the headset or handset. Always let the person know that you're on speakerphone and who else is listening on the call. Ensure privacy when on speaker. Sometimes when I was doing an advice nurse, working as an advice nurse, we would have the people on speakerphone before patients had come into the office. But generally it was better to have them on the headset or the handset because of HIPAA questions. Conference calls are where multiple people can call from different locations. A committee may want to discuss policies and procedures for the practice. It's better use of time than having everyone travel to the same location. Caller ID allows the user to see who is calling before he or she picks up. Sometimes this works in the office. Sometimes when you're transferred from another line, that feature is not available. Voicemail is widely used in today's business office because it affords an around-the-clock method for receiving patient messages. It can be frustrating to not talk to a live person, but it does allow triage of calls. But you need to get back to the patients because it can be considered abandonment if the call is not returned. We would frequently use the voicemail with advice so that when we were getting calls back to back, we could triage the call so we could call back someone with a head injury sooner than we called back someone with maybe a sore foot. It's been sore for a few days, but we could triage the calls. We did let the receptionist know, the medical assistants know to notify the families of this when they're transferring back to the advice team, that they will leave a message on voicemail and that they would then get back to them. Um, Call forwarding is a forward to an answering service, enables them to do that. Intercom allows for two-way communication without requiring you to pick up the handset or use a headset. It's not confidential, and but it can be used to notify staff of an emergency. The call hold button allows you to interrupt a call momentarily. It can be used to retrieve information or to speak with someone else to get some information. It's very important to be courteous and respectful of the caller. Sometimes I would say, let me check to see if the provider has arrived in the clinic in the morning if we had a call from someone who wanted to speak with the provider. And then we would go back to look for the provider. The problem is sometimes people see you and then they may ask you other questions, and then you have to just keep reminding them that you're on the phone, you need to get back to the person. And then you also need to let the provider know that the person's on the phone waiting for an answer. There's also speed dialing. It allows you to program keys on the telephone keypad to automatically call a stored telephone number by just pressing one key. Particular laboratory for specimen testing, all staff members must know which telephone numbers have been programmed into a particular keypad number. Cell phones used to be considered a luxury item. It's now become more commonplace. Many people no longer have landlines. Can present issues in a healthcare facility. Cameras can capture confidential information. Calls could come at inopportune times. Most healthcare facilities have a policy that prohibits employees from having their personal cell phones with them during work hours. The provider's cell phone number should never be given out to patients without the provider's permission. Some of the equipment that's needed in a healthcare facility: two incoming lines along with a private outgoing line with a separate number is the minimum. One medical assistant can handle no more than two incoming lines. A telephone should be available in the laboratory area and the clinical area, and then multiple phones should be present in reception and business office areas. If a staff member is assigned solely to dealing with insurance and billing, a separate line and listing in the telephone directory for this service may considerably lessen the load on the incoming calls. And the telephones should be placed where they are accessible but private, um, so that you can make calls and talk to people on the phone, again within HIPAA requirements. May seem odd to start out discussing listening instead of speaking in this chapter, but listening well while on the telephone is just as important as speaking well when it comes to communicating on the telephone. When you are on the telephone, you have fewer nonverbal cues to help you determine the message. Therefore, it's important that you use good listening skills. When you use active listening skills, your patients realize that you think they are important and that you respect the message they are communicating to you, whether you are on the telephone or face to face. So be present in the moment, focus solely on the conversation. Now, this can be difficult if there's an emergency going on within the clinic, something else going on. It's important that you notify the person on the phone. I'm sorry, we're having an emergency here in the office at this point. Let me call you back when the emergency is over, or if you can hold on just a moment, or just let me know. You could get a brief description of what is going on, but it is helpful to let them know that. Don't interrupt when possible. Don't start forming your response before the person is finished speaking. Confirm what the speaker has said and ask if your interpretation is correct. And always be respectful and professional. Each time a medical assistant answers the telephone, he or she is representing the healthcare practice. The manner in which the telephone is answered can influence the caller's impression of the whole office and whether the person wants to be seen there. When patients call, they should hear a friendly yet professional voice. You should always smile when you answer the telephone. The physical act of smiling affects how your words sound. It is as if your called can hear you smile, the caller, and you have created a positive impression. Be aware of the tone of your voice. The callers can tell if you're preoccupied and not focused on the current conversation. You should vary the pitch of your voice and avoid speaking in a monotone. Use proper enunciation, diction, pitch, and clarity. Enunciation is crucial when speaking on the telephone. Use pleasant inflection with friendly, warm tone. Use courtesy and be tactful. Think about the words you'll be using before actually speaking them. For those of us working in a healthcare facility, it's easy to integrate medical terminology into our conversation. However, it's important to avoid medical jargon and use correct grammar. For example, don't use NPO, you'd want to say nothing by mouth. Never answer the telephone while eating, drinking, or chewing gum. And give the caller your full attention and present a professional, friendly image of the office. Be sure to speak at a moderate rate of speed because speaking too quickly makes it difficult for the caller to understand you. And then we have procedure 10.1 to demonstrate professional telephone techniques. So thinking ahead, we want to keep the call short and simple to free the line for other calls. Before a call, have all necessary information ready. Have a pen and pad ready to take notes. Write down our list of questions or goals for conversation. Keeping a list of frequently called numbers saves time as well. I know we would have, if we knew who the patient was when they've left the message, we would then bring up the patient's chart so we knew who we were talking about. We would confirm the birth date and the name of the child before we actually started talking to the person. For outgoing calls, have all the information you need, such as the patient's health record, the telephone number of the person you'll be calling, maybe a list of questions and a pad and pen to make notes during that conversation. Remember confidentiality. All communication in a healthcare facility must maintain patient confidentiality. If the patient-sensitive information needs to be discussed, place the call in an area where others cannot hear, and be careful when using a speakerphone. The sound may travel further than you think. If the call is an emergency, prompt attention to it could save a life. You must know how to activate emergency medical services in your area, which is to call 911. You would treat the phone call just as if the patient were standing in the office. You should always find out the nature of the call before placing them on hold. Ask them if it's okay to be placed on hold. Answer quickly, always by the third ring. With multiple lines, place the first call on hold long enough to ask the second caller to hold. You always want to ask what the call is about. Sometimes people will start to go into a long story, so you may have to interrupt in order to get to the next line to make sure, again, triaging what's most important at that time. If an emergency, let others on hold know they may have to wait or be called back. And do not multitask while on a phone call. So if you're working on a phone call, you don't want to be writing lab work for another patient or writing lab orders, those kind of things. So when answering the phone, you want to identify the facility first, say your name, choose a greeting, and practice saying it. This may be identified by your practice of what you will say or not say. I know when we were bought out, we had other companies that became part of our practice. We had to then change how we answered the phone. Sometimes physicians will avoid using the term doctor when calling a patient to protect the patient's confidentiality, particularly when calling a shared line or a place of work. Never rush. All callers should be able to clearly understand exactly what is being said. You want to identify the caller. Unidentified callers could be patient, Could be a patient, therefore every attempt to identify the patient and assist him or her should be made. Such callers may also be salespeople who are fully aware that if their identity is revealed, they will never get the opportunity to speak to the physician. So if the caller does not identify self, ask who is calling, write down the name immediately, try to use the caller's name at least 3 times during the conversation. And then handle callers who will not identify themselves according to office policy. For screening incoming calls, find out exactly how the calls are to be handled when the physician is out of the office and under what circumstances he or she can be interrupted when on the premises. First step in screening calls is to determine who the caller is and the nature of the call. If the call is an emergency, the policies for handling emergency calls apply. Many emergency calls require judgment on the part of the person answering the telephone in the medical practice. Good judgment comes from experience and proper training by the provider. It's important to know what a real emergency is, in addition to how such calls should be handled. The person answering the telephone first should determine whether the call is truly urgent. If so, never hang up the telephone until an ambulance reaches the patient or other help arrives. When necessary, ask another staff member to call 911 while remaining on the line with the patient. Emergency calls may include such conditions and/or symptoms as chest pain, profuse bleeding, severe allergic reactions, sensation of breathing, injuries resulting in loss of consciousness, broken bones. An urgent call may be an adult patient with a fever over 102, an animal bite, or an increasingly painful ear infection. Emergency calls are life-threatening. So the difference between an urgent call and an emergency call, it's where an urgent call requires prompt attention, but it's not life-threatening. In the case of emergencies, often the provider instructs the patient to go straight to the closest hospital emergency department instead of the office. Policies and procedure manuals should indicate the action to take in emergency situations. When in doubt, ask the office manager and/or the provider. If the provider is in, the call may need to be transferred to him or her immediately. And then you would want to learn the preferences for receiving calls or returning them later. Explain that the physician will return calls as soon as possible. Provide approximate time frame for when the caller can expect to hear back. And of course, confirm the number of the caller. Record any messages accurately and document calls. All offices should have a written plan of action for the times the provider is not physically present in the office. These policies should include typical questions to ask the caller to determine the validity of and disposition of the emergency. These questions can be asked when handling an emergency call. At what telephone number can you be reached? Where are you located? What are the chief symptoms? When did they start? Has this happened before? Are you alone? Do you have transportation? Screening guidelines, provider may designate one individual as the telephone screener, such as a nurse or experienced and trained medical assistant. Every healthcare facility would be wise to have a written telephone protocol for handling urgent situations and emergencies. Protocol should state that employees are bound by written guidelines and unauthorized personnel may not give advice. If advice is given by a medical assistant, it may be grounds for dismissal. Use specific sheet of instructions listing specific medical emergencies such as chest pain, heavy bleeding, fainting, seizure, poisoning. Guidelines should be posted by each telephone. The telephone numbers for the nearest poison control center, hospital, and ambulance should be listed as well. Emergency calls should be routed immediately to the provider. Additional instructions should include what action to take if no provider is available, maybe sending the patient to the emergency department or calling for an ambulance. Most offices have some means of constant contact with the provider, whether by pager or cell phone or another method. As the medical assistant gains experience and knows the provider better, he or she begins to have a sense of the questions the provider will have for patients who call the facility. For example, the provider is interested in how long the patient has had symptoms, what makes the symptoms better or worse, what remedies have been tried, what has worked, what has not worked, and other specifics about the condition. If the patient complains of painful urination, the medical assistant learns to ask about pain in the back or blood in the urine. One way to learn about questions is to ask to listen to the provider carefully as he or she questions patients about their symptoms. This can help you learn more about signs and symptoms and enable you to be a better assistant to the provider. Remember to always be patient with patients. Those who call the healthcare facility for help are almost never at their best. When feeling ill, people are often short-tempered and even display poor manners. Some can be verbally abusive. Care for patients as if they were family members, and they will feel care and compassion in the medical facility. If the provider is unavailable for only part of the day, take a message and inform the caller that the provider currently is out of the office, but will return calls when he or she returns. It's important to give the caller the time frame in which the provider will be returning those calls so that the patient's time is not wasted sitting by the phone waiting for the call. It should be stressed that the time frame is approximate because emergencies cannot be predicted. If the caller is unavailable when the provider usually returns calls, ask what would be a convenient time and let the caller know you will try to work with that time frame. Screening calls is an important task for medical assistants who answer the telephone. It can keep the healthcare facility running on schedule and ensure that calls that need to get to the provider do so immediately. When you're working with a multiple line telephone, it's not uncommon for more than one call to come in at a time. If you are on one call and another rings, you should put the first call on hold and then answer the second call, and then determine if it's an emergency or not. If it's an emergency, follow the emergency call procedures. If it's not an emergency, ask if you can place them on hold and then return to the first call. The medical assistant should always ask before placing a caller on hold. If it has been determined through the screening process that this is a call that does not need to be put through to the provider right away, or if the caller needs to be transferred to someone else in the healthcare facility and that person is not immediately available, you should ask if the caller would like to be put on hold or if he or she would prefer to be called back. If you know the person with whom the caller needs to speak may be busy for quite a while, inform the caller of that. The caller may still want to wait. Once per minute, check back in with the patient holding for the physician, and then offer to have the call returned rather than wait on hold. And then always thank the caller for waiting on hold. Minimizing the wait for the caller shows concern, and freeing up the telephone line is important for other people trying to contact the healthcare facility. Requests that might require pulling the patient's chart from the files are best handled with a call back to the patient. Remember that leaving a patient on hold ties up one of the physician's telephone lines, and an emergency call could be coming through, or new patients might be attempting to call. During the screening process, the medical assistant may determine that the call should be transferred to the provider or to another person at the facility. Consider the following example. Ms. Fields calls your office because she has a billing question. You should ask Ms. Fields permission and wait for a response before placing her on hold. It is also helpful to give Ms. Fields the name and extension of the person to whom you will be transferring her call, if it's not the provider. This way, if Ms. Fields' call happens to get disconnected, she will have that information when she calls back. Once you have Ms. Fields' permission to put her on hold, you should contact the person to whom the call is being transferred. In this case, that is Mr. Lewis in the billing department. Tell Mr. Lewis who is calling and the reason for the call. This allows Mr. Lewis to be prepared to help Ms. Fields when the connection is made. Mr. Lewis may ask for a moment to pull up information before you put Ms. Fields' call through. You should stay on the line to introduce Ms. Fields to Mr. Lewis and to make sure the connection is made. If Mr. Lewis is unavailable, you should ask Mrs. Fields if she would prefer to leave a message or leave a voicemail, or if you wanted to take a message for her, if she wanted you to take a message. Some callers may prefer that you take a message in written form and bring it to the proper person. The medical assistant who answers telephone calls must know who does what in the healthcare facility. An organizational chart with telephone extensions can be helpful, but it must be kept up to date so that calls can be transferred successfully. Any person who refuses to give a name should not be put through unless the medical assistant has been specifically instructed to do so. Because the physician's office is a hectic place, Most require that a message be taken so that the medical record can be reviewed, the patient's request considered, and the patient called back with questions or instructions from the doctor. Telephone messages, whether taken in a handwritten or an electronic format, are an important part of patient care. The patient relies on the medical assistant to get the message to the appropriate person. Taking messages allows information to be delivered to a provider or an appropriate person who can make a decision either then or later, which can be communicated back to the patient without interrupting the flow of patients through the healthcare facility. You should be sure to let the caller know when to expect a call back. For example, explain that the provider usually returns calls between 3 and 4 p.m. Whether the message is taken in a handwritten or electronic format, the information needed for a complete message is the same, and that includes the name of the person calling, the name of the person to whom the call is directed, all contact numbers for the caller, the reason for the call, the action to be taken, the date and time of the call, and then the initials of the person taking the call. Never use small scraps of paper for messages, they are too easily lost. And there are impression-sensitive message pads, which provide a copy of each page and ensure that no message is forgotten and are the best way to keep track of handwritten messages. The original is given to the person the message is for, and the medical assistant will have a copy to use for follow-up. Having legible handwriting is a must when taking a manual handwritten message. And then look at figures 10.2 and 10.3 in the textbook. This is ways to take a message here. This is one of the figures from your book about the information here. An imprint, this probably has an imprint so you can have a copy at the back for the phone message. Electronic software systems usually provide the name, the address, and the phone number, the date and the time of a message. Therefore, you only need to type in the reason for the call and what the patient would like the physician to do. The electronic system may also be able to flag a message to indicate that it's urgent or that it requires a call back or that a prescription refill is expected. So this is perfect. This is something that you'll see in Epic charting or electronic charting. This SIM chart here shows the name and it automatically populates much of the information. Message procedure is incomplete until necessary action is taken. If a handwritten system is used, use an identifying mark to indicate a message that requires action. If an electronic system is used, check periodically during the day to be sure you do not have to complete the message, the response to the message, such as calling the patient back or contacting the pharmacy. For risk management purposes, the healthcare facility should have a policy on the documentation of telephone messages and the specific information that must be included. Medical assistants should become familiar with that policy. Do not trust to memory messages that were not intended to from previous days. Always carry them forward either electronically or in writing. And Procedure 10.2 outlines how to document a telephone message and report relevant information concisely and accurately. Note a patient's attitudes if significant to help the physician when returning the call. If a handwritten system is used for recording telephone messages, the office should have a policy on retention of message records. If the message relates to patient care, a copy of the message should be added to the patient's health record. Keep handwritten message pads for a period of statute of limitations. If the health record is electronic, this may mean scanning in a copy of the paper message and attaching it to the EHR. Electronic systems should send directly to the medical record. The message is saved to the record along with the response to the message. The message record can show whether the patient contacted the office, if the office responded to that contact, and what the response was. All of these are key points if a medical professional liability case is brought against the provider. Make sure accurate telephone records are kept to ensure good patient care and customer service. Handling incoming calls for prescription refills is often the responsibility of the medical assistant. You can handle many calls directly, but some will require the assistance of others. Knowing how to respond to the different types of calls will make you a valuable asset to the healthcare facility. Patients will often call the healthcare facility when they need a prescription refill. It could be that there were not refills left on the original prescription or that they've used up all the refills. The information needed from the patients when they request a prescription refill includes the medication name, the dosage, how many pills are taken in a day, any issues with medications, and do they want a pharmacy mail order service, or will they pick up the prescription? With all of the attention deficit medications, those all need to be monthly refills, so we would get these calls monthly for these medications. It's important for a medical assistant to be familiar with the common medication names and abbreviations used in a prescription. Using the correct spelling of the medication is very important as well. In your book, there's Appendix A, it has common medications, and Appendix B has abbreviations. You'd also want the pharmacy address and phone number on that for a prescription refill. Other calls that you might get are requests for directions. You want to have an accessible, clear set of directions on how to get to the office, written out to read to the caller if requested. Prepare directions from various points in the area. For instance, one set for a patient coming from the north and another from the south. Place these directions close to the telephone so that all employees can access them easily. Not all employees live close to the clinic or are familiar with the area. Therefore, the written set of directions will be helpful both to staff members and to patients. Place a map on the office website for patients to print. And then do not simply suggest that the patient refer to an internet map. Don't just say you should look on Google Maps. You should give them the actual directions. Another call that you may receive is a patient may ask to speak with the provider about a recent bill. Ask the caller to hold for a moment while the ledger is obtained from the computer or files. Then, if nothing irregular is found in the ledger, return to the telephone to say, I have your account in front of me now. Perhaps I can answer your question. If it's routine, you may be able to help answer that. Most likely, the caller will have some simple inquiry, for example, whether the insurance company has paid its portion, or the person may want to delay making a payment until the next month. Not all patients realize that the medical assistant usually makes such decisions and is the best person with whom to discuss these matters. When necessary, post a note in the EHR or to the physical ledger card about the patient's call, such as a promise to pay on a certain date. And then refer to the billing office if necessary. If the healthcare facility uses an external billing service, you may need to provide the caller with that agency's telephone number. When an external billing service is used, that telephone number is often shown on the patient's statement as well. The patient may have questions about a statement that came in the mail. If billing matters are handled by another employee, tell the patient that the call will be transferred to the billing office. If you are responsible for billing, politely ask the patient to hold the line while you obtain the patient ledger. On returning to the line, thank the patient for waiting and explain the charges carefully. If an error has occurred, apologize and say that a corrected statement will be sent out at once. Always remember to thank the patient for calling. A way to reduce the number of calls related to bills is to properly advise patients about the charges at the time services are rendered. Fees vary widely in each healthcare facility, and quoting an exact fee before the provider sees the patient can be difficult. However, a good estimate, especially on the first visit, is helpful. Asking the patient to just appear at the office without having an idea of the cost is unreasonable. Discuss with the provider or office manager what range should be quoted to the patient, and then follow this by stating that fees vary depending on the patient's conditions and the tests ordered. Most healthcare facilities require patients to pay the health insurance copayment or copay on the day the service is provided, and the caller should be informed of this. If fees are regularly discussed on the telephone, write a suggested script in the policy manual. Do not be invasive. Have a schedule of fees available that you can discuss with the patients. Patients call to inquire whether a physician is a participating provider with their insurance plan or managed care organization. Keep an updated list of the valid plans by the telephone. Insurance benefits vary for participating and non-participating providers, and a claim will be denied or reimbursement lessened if the physician is not a provider for the patient's insurance company. Medical facility typically files insurance claims. In the ever-changing world of health insurance, patients are often confused about their coverage, how payment is determined, and what they are actually financially responsible for when it comes to their bill from the healthcare facility. Patients may call to inquire about their claim status. A solid understanding of the basics of health insurance, including managed care, allows you to answer patients' questions about insurance. If the question is beyond your knowledge, you should know to whom to transfer the call so that the patient can get an answer. Insurance is a difficult subject to understand, even for trained individuals familiar with the various forms and procedures. Answer inquires patiently and provide help. Other calls that you may receive are radiology and laboratory reports. Because of the increased use of electronic health records, radiology and laboratory results often are available to providers as soon as the technician has completed the test. When the patient calls for those results, a message is taken, and the provider decides whether the medical assistant can relay the results or the provider needs to speak to the patient directly. When tests are done at a facility that is not linked to the healthcare facility's EHR, the findings usually are delivered by mail to the provider's office. If the test has been marked stat, the physician wants the results immediately. The results may be urgent reports, may be faxed or telephoned or emailed to the physician's office. And then original reports usually are delivered by mail for the medical record. Some facilities receive laboratory results directly from the laboratory by the computer. It's helpful to have blank laboratory results forms available that list the various tests with their normal values so that you can easily and accurately document results telephoned to the healthcare facility. This can save time and you can be assured that the test name is spelled correctly. You should repeat the results you have been given to make sure you have written them down correctly. This report must be documented in the patient's health record and sent to the provider for review. With ours, when I was working as an advice nurse in the pediatrics office, we would often get the bilirubin results for the newborn babies. And so those results we would have as stat. They would need to know those immediately to see if the baby needed to be readmitted to the hospital. Sometimes providers will ask patients to telephone the office to report on a condition a few days after the visit. You take the calls and relay the information to the physician if report is satisfactory. Assure the patient that you will inform the provider of the call. The report should be documented in the health record. Immediately inform physician if the report is unsatisfactory, and he or she should provide instructions for the patient to follow in case of an unsatisfactory report. The provider may discuss this directly with the patient, or the medical assistant may be instructed to relay the information to the patient. All instructions given should also be documented in the health record. Hospitals and other sources may call to report a patient's progress. You take the message carefully and give to the physician. After giving the message to the physician, you would then file that report, that message in the patient's medical record. Another type of call that you might get is a request for a referral. Well-respected providers, especially primary care providers, are often asked for recommendations for referrals to other specialists. It may be handled without consulting the physician if there's a list of referral practitioners if provided, unless the patient's insurance plan requires a written referral. However, the provider should always be informed of such requests. If an insurance plan requires a written referral, physician must handle it. Most physicians require office visit to discuss a referral, and then they call the referral physician and notify them of the referral. This can also be done electronically. A managed care organization may offer the option of using its website to enter the referral information and then electronically forwarding the information to the new provider. You want to handle these calls as quickly as possible so that the patient may make an appointment to see the referral physician. Document all referrals in the medical record. So we would often get referrals. Sometimes we would have like psych referrals if a person wanted to have someone to talk to a therapist, one of their children to talk to a therapist. We had a list of different providers. If it was something that we weren't sure what kind of a therapist to provide the person, we would recommend an appointment so the doctor could talk to the patient and then find out what specific referral should be made, if it should be made to a dermatologist or an orthopedic doctor, someone who deals with broken bones, or maybe a dermatologist or a podiatrist, just kind of depending on what exactly the problem was. And not all calls concern patients. They may come from accountants or auditors or other non-patients about banking procedures, office supplies, office maintenance, most of which the medical assistant can handle or refer to the appropriate person. The medical assistant would need to gather additional information and then return the call later. Pharmaceutical reps and salespeople will often call and ask to speak to the provider. The provider may decide to return these calls or ask that an appointment be scheduled to talk about the new product. It's also possible that the provider will ask the office manager to talk to the salesperson. You just want to take the message that includes what product they want to talk about and then provide that to the provider. Occasionally, patients call and want to talk with the provider about symptoms they're reluctant to discuss with the medical assistant. Some patients may insist on discussing those symptoms only with the physician over the phone. Patients have the right to privacy, but the physician cannot be expected to take numerous calls from patients who do not want to speak to the medical assistant. So if the patient refuses to discuss the symptoms, suggest he or she make an appointment to discuss in person with the physician or follow the healthcare facility procedures. Sometimes we would get these calls and then they would usually transfer, the medical assistant would transfer these to the advice nurse who could then relay the information to the provider. If a patient under treatment reports that he or she is still not feeling well or the prescription that the provider wrote is not helping, do not give medical advice to patients. It's illegal to practice medicine. Make detailed notes about the patient's unsatisfactory progress. Present those notes to the provider. The physician may make a medication change or may decide that the patient should return to the office. Follow up with the patient with the physician's instructions. When the provider orders special tests, the patient may be told to call the office in a few days for the results. It is ultimately the responsibility of the provider to notify the patient of the test results, especially if they are abnormal. When a patient calls for test results, the physician must see the results and give permission to share the results with the patient. If specified in the office policy, the medical assistant can give test results to the patient. Patients do not always understand that the medical assistant does not have the privilege of giving out information without the permission of the physician. If the result is unfavorable, the physician should be the one to inform the patient and give further instructions. This call must be handled tactfully, otherwise the patient may feel as if the staff is concealing information. Most providers prefer that medical assistants give only normal test results to patients. However, the medical assistant may provide abnormal test results if authorized and give further instructions. For example, when a patient has an abnormal pap test result, the medical assistant usually is the person who calls the patient with the result and further instructions from the provider. Refer any questions to the physician. The medical assistant needs good communication skills to relay information such as this without crossing the line of practicing medicine without a license. The best policy for dealing with more serious abnormal test results is to schedule an appointment for the patient to see the provider. These types of tests best relayed in person. Identify the patient properly before giving the results. When you do call, when the patient calls the office for the test results, some offices use a special code that is written in the patient's health record, and knowledge of the code or password gives the person access to the information. Other offices may use the patient's date of birth or other information that is known only to the patient and has been shared with the healthcare facility. You should always use at least 2 different methods of identifying the patients. Medical assistants must know and follow regular federal regulations and the laws in their state regarding the release of information to someone other than the patient. It's important to note that this includes information about a minor. Make sure that the right individual is on the line before offering results by verifying the name and date of birth. It's considered a breach of confidentiality and may breach HIPAA regulations if they do not identify the patient accurately and information is released to the wrong individual. Sometimes this would happen when we have divorced parents, 2 parents. We would give the result to one parent and the other parent, this parent didn't even know that the test was ordered, and that could cause problems. So you'd always want to make sure that you're calling the correct person. Patient must give written permission before any information may be given to third-party callers, including insurance companies, attorneys, relatives, neighbors, employers, and any other third party. And like I said, permission must be given for any third-party callers. HIPAA is very specific about the information that should be included in the release of information form. The patient must specify who can receive the information and exactly what information can be released. The release of information must include an expiration date. The medical assistant must carefully review the patient's form before releasing any information to third parties. A medical assistant may be able to offer a satisfactory explanation to a patient who complains about the care he or she receives of the charged fee. Often the patient simply does not understand a charge, and the medical assistant can provide assistance by reviewing the bill, explain the charges, and then if the patient is angry, offer to pull the chart, research the problem, and then discuss with the physician. Some of the most magical words when calming an angry person include, "Let me help you." Reassure the patient that you want to help. If you are unable to appease the patient easily, the physician or office manager may prefer to talk directly to the patient. When callers complain, do not attempt to blame someone else and never argue with the patient. Find the source of the problem and then present options to the caller as to how the situation can be solved. Remember to treat callers in the same manner that you would wish to be treated. A complaint may seem small and insignificant to the office staff, but it may be a serious issue to the patient. Provide good customer service to patients, and complaints will be few and far between. Personal calls can tie up the telephone lines. Emergency calls could be coming through, and the lines must be clear. Personal calls to the physician you want to handle according to the physician's instructions and be tactful. Personal calls to staff, only take personal calls in case of an emergency. And no matter how efficient the medical assistant is on the telephone or how well liked the provider might be, sooner or later an angry caller will be on the telephone. The anger might have a legitimate cause, or the caller's irritation may have resulted from a misunderstanding. Handling such calls is a real challenge. First, take required action, even if it's to say that the matter will be discussed with the provider as soon as possible and that the patient will be called back later. If the answers are not readily available, acknowledge the importance of the call and reassure the caller of your assistance. The medical assistant may find that lowering your tone of voice and volume to encourage calm behavior may force the angry caller to do the same. This method does not always work, but is usually is true when dealing with an angry person. Calm promotes calm. Some patients may misread this method and become even angrier, thinking that this complaint is not being taken seriously. Interpersonal skills are critical when dealing with other individuals because the more skilled the medical assistant becomes, the better able he or she is to deal with multiple types of personalities. Always avoid getting angry and try to get to the real root of the problem. Try to avoid being defensive. Express interest, take careful notes, and follow through. Never pass the buck by saying, "This isn't my job," or "I'm not the person who filed that insurance claim." No matter whose fault the problem is, it's best to deal with it and find a solution instead of placing blame. It's important to respond to the patient when you said you would, even if the call is to tell him or her that you need a bit more time to work on the problem. Keeping the patient in the loop shows that you want to come up with a solution. Aggressive callers typically insist that they receive whatever action they feel necessary immediately. Treat them with calm, poised attitude. Do not let aggression force you to take inappropriate action. Reassure the caller that the concern being shared is valid and will receive the full attention of the right person. Explain when the caller can expect a response from the office, and follow up that appropriate action was taken. Callers requesting information to which they are not entitled should be politely denied. Information cannot be provided to them because of privacy laws. Insistent callers should be referred to the office manager or provider. Sales calls often are thought of as an interruption to the provider's busy day, but some salespeople may have important information on products, equipment, or services the office uses regularly. Do not disregard salespeople, but do not allow them to monopolize time or telephone lines either. Keep sales calls quick and to the point. Most professional salespeople realize that the providers and staff time is extremely valuable and respect this. It may be the healthcare facility policy to give the salesperson an appointment, possibly over lunch hour, to discuss the new product or service with the provider and/or office manager. Know which companies and representatives office works with. Developing a good rapport with representatives or reps from the companies whose products are frequently used in the practice may result in discounted prices and first news of sales and promotion. In turn, these professionals rarely waste the time of the office personnel. Occasionally, calls come into the office from patients or family members who have difficulty with the English language. If callers are not primarily English speakers, they may be difficult to understand. If a certain language is predominant in the area, the physician should consider hiring a medical assistant who is bilingual. Some patients speak English but have a heavy accent, so you should listen carefully. Use your listening skills to understand and ask questions to be sure you understand. Many resources are available to assist with translation. The healthcare facility may contract with a translator who would be available to help with telephone calls and patient visits in the office. Many online services also offer translation. If the healthcare facility has a number of patients who speak with a specific language other than English, it would be helpful to have commonly used phrases available in that language, especially the phrase that would refer the patient to the specific translation service used by the healthcare facility. Some providers may have a number of patients who are deaf or hard of hearing. These patients may use a relay system to communicate with healthcare facilities over the telephone. Some relay systems have the patient use a keyboard to enter the information to an operator, who calls the office and reads the information to you. Your response is then typed back to the patient. Newer technology uses an online caption telephone service, much like closed captioning for television. Many smartphones can use a translation app to assist the caller. You should be familiar with the way this system works so that you can engage in these conversations in a professional way. We've been talking about all of the incoming calls, and now let's talk a little bit about the outgoing calls. Most outgoing calls are responses to incoming calls. And the same rules for courtesy and diction apply to calls made from the office to patients, other individuals, and businesses. It's helpful to plan outgoing calls in advance. For instance, if the medical assistant is placing an order for office supplies, a list should be made that includes the product, the price, the quantity needed, and a catalog page number if applicable. Questions about the various products ordered should be noted so that they can be asked while the sales representative is on the phone. Some medical assistants may find it helpful to make all outgoing calls at once when possible. This way, the calls can be made one after another, and if a callback is necessary, the medical assistant is likely still by the phone. Organize the calls increases the efficiency as well. Never be rude to an individual on the phone. Remember to treat those on the other end of the phone as you would wish to be treated. Do not forget that you are a representative of the provider and that you must behave in a professional manner at all times. Time zones. When making outgoing calls, it's important to keep in mind time zones, especially when calling patients. Most of our patients are on our same time zone. It would just be if they were traveling. If you are trying to contact a patient who's spending the winter somewhere else, you should place that call at an appropriate time for the patient. Generally, people don't spend the winter somewhere else here in California or the summer somewhere else. But you may be trying to get a hold of insurance companies or other types of companies that may have be on a different time zone. Call when someone will be available to answer. We usually would call during their lunchtime because we would get into the office at 9 and it would be noon on the East Coast. So just keep that in mind. Continental United States is divided into 4 time zones. Pacific, Mountain, Central, and Eastern. When it's 2 p.m. on the West Coast, it's 5 p.m. on the East Coast. You can look at figure 10.4 in the textbook. A little bit less likely that we'll have patients in different time zones. Sometimes people are traveling internationally, and then usually they wake up whenever they need to or are awake to call us during our time zone. Long distance calls are a little bit less of an issue these days with cell phones and other long distance services are in toll-free numbers. But there are simple to place, usually inexpensive, efficient way to get information. Generally, we would use the internet and find a search of the company website if we had some kind of question about a product. If you need it in a hurry, telephony is much more expedient than written communication. Before placing a long distance call, have the correct number ready. Some areas we have directory assistance. We don't have directory assistance here. We would just search for the number on the internet. If you reach a wrong long distance number, be sure to obtain the name of the city and state that was called. And if you would then report this to your local operator. Again, this is a little bit less likely to be an issue these days. Internet services like Skype allow the user to call long distance through a computer with no long distance charges. For telephone directory assistance, we would have a telephone directory for like Stanford, different offices at Stanford, different facility, doctors at Stanford. Um, Long distance, you could dial 911, but I don't think they have this available anymore, the 555-1212 number. I would use for directory assistance, I would just use the internet. Um, I think that's the easiest way to find telephone numbers for companies. And then answering services, patients expect to be able to contact their provider if an emergency arises. This means that the telephone in the healthcare facility must be answered at all times, day and night, weekends, and holidays. During normal hours, the medical assistant is available to answer the telephone. After office hours, most healthcare facilities use an answering service or answering machine. With the answering service, an actual person answers the call, which can be comforting for patients. The staff at the answering service can act as a buffer for the provider after hours by screening the calls. By following the criteria given to them by the healthcare facility, patients can determine whether the provider or on-call person should be contacted or the patient directed to the hospital emergency department, or whether a message can be taken and relayed to the healthcare facility in the morning. It's common courtesy to call the answering service in the morning to let them know that you will be answering the calls and also to retrieve any messages taken overnight or over the weekend. You should also call the answering service when you are leaving for the day. Answering services also can be used to cover the telephone if all staff members need to be away from the telephones at the same time. We would have what was called the night nurse, and they would answer during the nighttime, and then they would fax us the um, the messages that had come in overnight. They would then contact the provider in the middle of the night if needed. Many healthcare facilities have started using an automatic call routing system. The caller is given a menu of choices, and he or she then presses a number on the telephone keypad to direct the call to the correct department. This can be an efficient way to handle a large volume of calls, but it can also be frustrating for some patients, especially elderly adults who may have trouble hearing and remembering the options. It can be frustration, can be minimized that frustration if they provide an option that connects the caller with a person option. For example, dial 0 for an operator. Then they can bypass the automatic call routing system. Today's telephone services systems allow providers to educate patients while they are on hold. There can be recordings that offer health information that can play. These messages can be professionally recorded or custom designed by the provider and staff. They could be about special events that can be announced. Such features help address the needs of today's more information-oriented healthcare consumers who are interested in healthy lifestyles and gaining useful information immediately. Phone directories can offer listings of health information as well. Take care that no one overhears sensitive information while on the phone are some of the legal and ethical issues related to this chapter. Use discretion when mentioning the name of the caller or the patient. Do not place or receive personal phone calls during work hours. Time limitations for personal phone use should be described in the Office Policies and Procedures Manual. The telephone is a business line and should be reserved for patients and others conducting business with the office. Personal cell phones also should not be used during working hours. This takes the medical assistant's time and attention away from patient care. Telephone and message records may be brought into court as evidence, and make sure all messages are complete and legible. Most offices should keep these records for at least the same period as the statute of limitations in that state. When answering the telephone in a healthcare facility, the medical assistant has many opportunities to provide patient-centered care. First and foremost, you should always respect the patient's preferences. This could be using their cell phone number for returning calls or using their preferred name or nickname when calling them. Secondly, telephone communication is a big part of coordination of care. Remaining professional in all interactions will ensure that the patient's needs will be met. And that's it for Chapter 10. Have a good day.